Patient assessment, scene assessment, and primary assessment. This video will demonstrate the completion of a scene assessment and primary assessment as part of the overall patient assessment process. Scene assessment. Before beginning your assessment of a patient, carefully assess the scene, noting any safety issues that could affect you and your fellow rescuers, bystanders, or patients. If dangerous conditions are present, do not enter the scene until it has been made safe. Safety issues include, but are not limited to, fire or electrical hazards, the presence of hazardous materials, dangerous traffic or weather conditions, hostile individuals, the presence of weapons. As part of your scene assessment, ask yourself these questions. What happened? What was the mechanism of injury? How many patients are involved? If there are multiple patients, what additional resources are needed? Are additional ambulances and EMS personnel needed? Does the patient's condition appear critical? Are other resources needed, such as police, fire, rescue, or hazardous materials units? Based on your assessment of the scene, don any additional PPE as dictated by the assessment. Primary assessment. Once scene safety and personal protective measures have been taken, begin the primary assessment. The purpose of the primary assessment is to identify and correct any life-threatening issues as they are encountered. If any life-threatening issue is identified during the primary assessment, correct the threat and consider the patient to be critically injured. When assessing and treating a critically injured patient, limit the time spent on scene and the number of interventions performed to those that are absolutely necessary. At the same time, prepare the critical patient for rapid transport to the closest appropriate facility. While patient assessment is taught as a linear process, multiple steps can be performed simultaneously. In some situations, the patient assessment process may even be completed out of sequence. For example, you may need to apply direct pressure to control a severe external hemorrhage before you can assess the airway. Life-threatening issues include, but are not limited to, inadequate or threatened airway, impaired breathing, significant bleeding, either external or suspected internal hemorrhage, abnormal mental status, penetrating trauma to the head, neck, torso, or pelvis, amputation or near amputation above the wrist or ankle, trauma in patients with serious underlying medical conditions, patients who are less than 5 years of age or over 55 years of age, patients with burn injuries, or pregnant patients. To begin, you or your partner should assess the patient's responsiveness if it is not already established. If a spinal injury is suspected, manual inline stabilization of the patient's head and neck should be initiated. Next, examine the patient's ABCDEs. A. Airway. Assess for airway compromise by looking for foreign matter in the airway and listening for abnormal airway sounds, such as gurgling or snoring. If the patient's airway is compromised, open the airway with a trauma jaw thrust maneuver and clear the airway with suction if needed. B. Breathing. Assess for spontaneous breathing by listening for air movement and watching the patient's chest rise and fall. Is the patient's breathing absent, too slow, too fast, or adequate? Auscultate each side of the patient's chest for the presence of breath sounds. If the breathing is not adequate, provide or assist the patient's ventilations with supplemental oxygen. If the patient's breathing is adequate, provide supplemental oxygen. C. Circulation. Assess the patient's circulation by checking for signs of gross external hemorrhage. If such signs are present, apply direct pressure or other means of hemorrhage control. Check for the presence of a radial or carotid pulse. Is the pulse absent, too slow, too fast, or adequate? If the pulse is absent, begin resuscitation efforts if indicated. Are there signs of internal hemorrhage from the mechanism of injury or injury patterns? You may need to expose the patient's chest, abdomen, back, and thighs to assess for signs of bleeding completely. Are there signs of shock, such as rapid pulse, rapid breathing, pale skin, cool and moist skin, or decreasing mental status? D. Disability. Continue the primary assessment by assessing for neurologic deficits. Is the patient awake and talking normally? If not, does the patient respond to a verbal or painful stimulus? Are there reversible causes of disability, such as hypoxia, hypoglycemia, or narcotic use? Assess the patient's pupils for equality and reaction to light. Assess for fluid draining from the ears and/or nose. E. Expose environment. While respecting the patient's privacy as much as possible, continue to remove the patient's clothing to visualize and assess the major regions of the body. This examination includes the chest, abdomen, pelvis, and thighs. Cover the patient whenever possible to maintain or conserve the patient's body heat. Critical patients. If the patient is identified as a critical patient, then the patient should be packaged for rapid transport to the closest appropriate facility. Securing the patient to a longboard will serve as a rapid full-body splint. Continue to reassess the primary assessment and effectiveness of treatments until the patient is delivered to the receiving facility.